Good morning. I'm Bill Patten, Interim CEO here at Sublette Health Center, and I'm bringing you a report from the regular board meeting that was held on October 29. As I mentioned in my first video, I want to make this a regular routine after every regular board meeting, giving you an update on what's happening at your community hospital. Tanya Hoffman, our board chairperson, was taking a much-deserved vacation, so Jameson Ziegler ran the board meeting. At 5:30, the board had education. Carolyn St. Charles from our management firm Health Tech provided a very good summary on credentialing and privileging. That's the process by which the organization makes sure that the doctors that work here are both trained and qualified to perform services. Medical staff has an extensive process that they use, and then they provide information to the board and make a recommendation, and the board ultimately is the one that has the authority to grant credentials and privileges to physicians. So Carolyn's in-service was a good overview for the board of the process, and she validated that the process that has been developed here at Sublette County is a very good one, and it checks all the boxes that are necessary for a robust credentialing and privileging process. The regular meeting was called to order at 6 o'clock. After setting the agenda, there were a couple of regular business items, approving minutes. There were a couple of policies that were discussed. That's one thing that the board is looking at changing. In the past, all policies went to the board for review and approval. We're now going to be looking at only what I call the big global policies that are essential for board governance will be taken to the board. All of the other day-to-day policies that are vetted by the medical staff and the leadership team will no longer be on the board's plate. So it will be something that will allow them to focus more specifically on governance responsibilities rather than day-to-day issues. Then they heard a series of reports. We had a report from the foundation. The foundation was pleased to report a successful campaign that is being wrapped up related to the construction of the new hospital. A couple more payments are expected from the foundation, but one of the difficulties, those unintended consequences of the government shutdown, is that the USDA isn't processing any of the paperwork that we need submitted so that payments can be made to our contractors. We're hopeful that that will end soon and that we'll be able to get back on track as far as making payments, but until USDA is back up and running, in some respects our hands will be tied. There was a good report from the foundation. There was also a report from the building committee talking about some of the punch list items that are being finalized, and then also a few of the little hiccups that we have faced as we have moved into a new building. Anyone that's done new construction knows that there are always a few hiccups that you don't discover until you're actually occupying the building. But we are very pleased now that the Sublette Center residents have moved up into the Heritage Home. That went very well. They had planned almost an 8-hour move process, and the team was able to accomplish it in about half that time. Special thanks were given to our EMS crew for helping out move a couple of our more enfeebled patients, residents. So that move has gone well and folks are settling in very nicely. I heard that we're at like a 95 or 98% satisfaction rate in the nursing home. Good news there. On the operations front, Lindsay Bond gave a report of a number of the departments that report to her. Lane Harrington, our CNO, gave a new format of a report to the board where she used 5 pillars: people, service, quality, finance, and growth. And so she broke down the topics that she reported to the board into those pillars. That is a standard approach that's used in many healthcare organizations, and I know at least one other vice president is going to start using that format in their board reports. The board also heard from Dr. Burnett as it relates to the providers. Later in the meeting, the board was happy to approve a contract for a new physician assistant. Just as an aside, it's important to let the community know that we are changing the model that we're using for staffing the emergency department. Rather than contracting with an outside firm as we have since the hospital opened, we're now going to, and this will be starting the 4th of January, we'll be contracting directly with employed providers. So our own physicians and physician assistants will be the ones providing the care in the emergency department. So medical staff approved that new schedule, and it will be a more financially beneficial schedule for us. So just an aside there. Dawn Walker gave an update on the nursing home. She was the one that mentioned the great work that EMS had done and that folks were happy in the new environment. Dom Sims gave a update. Dom is the Executive Vice President for Health Tech, our management company, and he talked about a number of the things that Health Tech is doing to assist us. A specific one relates to our billing functions. The community may not know it, but we went live with a new electronic medical record system on the same day that the hospital opened. And so we are still settling in with that new system. And as is to be expected, there are some issues with our ability to generate bills for our patients. Part of that is intentional. When you have a new system, you put all the billing on hold so that you can manually review everyone for accuracy and completeness. But part of it is system setup issues. So Health Tech has resources that they're going to bring to bear to help us get caught up with our billing. Right now, cash flow is very important to us, so we're very appreciative of the support that Health Tech is giving us. And then I gave a report to the board on the finances on behalf of the Finance Committee of the board. In summary, for the month of September, our revenues were much lower than budget. After all adjustments, about 1.2 million below what we had budgeted for the month. The good news is that our expenses were down below budget by about 100,000. After you do all of the non-operational adjustments, the loss for the month was a little bit in excess of $500,000, a number that clearly is not sustainable, but we believe that as folks get used to being able to keep their care local, that our volumes will grow. And so look for more information from us about the services that are available here locally. You don't have to drive to Jackson, you don't have to drive to Rock Springs or Kemmer to get your care. You can get it here locally. In fact, this video today is from one of our new emergency rooms, Trauma Bay A. So we're highlighting some of the new services in this little video that we're doing. So I would encourage people to vote with their feet, keep your care here locally. And one of the things, I'll talk about this more in a future report, we're going to be adding doctors to our clinics so that we have more capacity, so that as you need a primary care physician, we'll be able to do it here, right here in Pinedale or Marbleton. And then my report to the board, I covered a number of different policies that we're working on. I talked about that we're going to be putting a hold on non-medical staff related education for a few months. Again, cash flow being what it is, we're asking folks just to delay. Education is important and we're committed to doing our part to fund it, but for the next few months we're wanting to tighten our belts. So we talked about that with the board and with employees. The board talked about the process by which they're going to be recruiting a new permanent CEO. Remember, I'm an interim. I'm here to help the board through this. Let's get started with the new hospital process. But additional conversations will be necessary with the board to determine how and when they want to recruit a permanent CEO. We also talked about some other positions. So I recommended to the board that we need to bring in an interim CFO, Chief Financial Officer, and the board was supportive of that idea. There are a number of big projects. We have annual audits that need to be done. We have things that Medicare requires that are called cost reports that need to be done. And while our current financial team is strong, they need that executive leadership to help push them over some of these big projects. So we're going to be bringing in an interim CFO. We're also looking to hire a permanent human resources director. I told the board that at some point I want to talk with them about standardizing some of our titles. We use titles in different ways that mean different things, and I think it's important that we standardize those. So I'll be providing a template to the board to have a conversation. In a similar fashion, the board has been talking about the delegation of authority document that we have that defines who can do what as far as some of the big financial decisions. At the last meeting, I had given them some suggested changes for the first half of the document. We went through the middle part of it at the meeting yesterday, and then at the next meeting, we'll complete that process. But now that we're a larger organization and we have 4 distinct business lines, nursing home, hospital, clinics, and EMS, we're wanting to make sure that our delegation of authority document is consistent with the needs of a more complicated organization. So the board is working on that. We've already begun looking at CVs, resumes for a couple of new physician assistants as we staff out for that change in the physician, the ER coverage model that I referred to. We're also going to be changing a little bit how we staff the urgent cares, both in Pinedale and in Marbleton. And then we begun talking about the ER medical director and how we're going to make that part of that new staffing model. I talked about how we weren't profitable for the month of September, and I told the board that from my perspective, we have a volume problem more than we have an expense problem. So you can expect to see a little bit of marketing from us, again, working to educate the community on the new services that are available here. For example, you can now get your mammogram. We have state-of-the-art mammogram technology, so you don't have to drive anywhere. You can get that right here at home. So we're going to be working to make sure that you know all the services that are available locally. We also talked about our clinic structure. So right now the clinics are organized as what I would call just a traditional physician's practice. There are other models that are available that can be financially advantageous to us. And I think that it's important that we transition to one of those, but which one is the best model? And I suggested to the board that we need to do a little bit of analysis to make sure that we pick the right one of the 3 available models. The 3 are a provider-based clinic under our new critical access designation once we get that, a rural health clinic, or a federally qualified health center. So we're going to be working with one of our external financial companies, Eide Bailly, to do an analysis to tell us which of those is the most profitable option for us. And then early next year, we're going to begin the process to convert our clinics into that model. We also talked to the board about the conversions that we're doing to a new general purchasing organization as part of health tech. We now have the ability to buy our supplies at significant discounts over what we had been paying. This will be measured in the tens of thousands, if not into 6 figures, the amount of money that we will be able to save. We're going to be implementing a new sliding fee schedule so that folks that can't afford to pay their bills and don't have insurance will have a very structured process by which we'll be able to help them. And that's an important element for a new application that we're going to be submitting so that we can be a National Health Service Score site. National Health Service Score is a program that helps physicians and physician assistants get student loan repayment. And I'm sure you've heard that as our doctors come out of medical school these days, they're burdened with hundreds of thousands of dollars in debt. This is a program so that we can help our medical staff repay those loans without our money. So it's a good thing, but the sliding fee scale is necessary. We talked about the update related to our CMS numbers. In my last report, I talked about how we're in the second step of a 3-step process. Step 1 was getting the hospital licensed. That's been completed. We're open. Step 2 is getting that CMS number so that we can bill Medicare, Medicaid, VA, other government payers. We're still waiting for that. It's my sense that that is being held up by the government shutdown. We can't apply for critical access status, which is step 3 of the process, until we have those numbers. So every day I check my email, I check the mail to see whether we've got those numbers. That's very important to us. As I mentioned, we're suggesting that the board limit the number of job descriptions that they review. We're also suggesting that the operations reports that we give the board be broken down into a quarterly schedule rather than every department reporting every month. Again, we're trying to make the board more efficient so that they don't have to work late into the night when they have a board meeting, and that they can focus on the big picture governance topics, not many of the day-to-day issues that are a responsibility of the medical staff and the leadership team. Gave the board an update related to the Rural Health Transformation Program. Remember, that's the grants that will be available to states out of the One Big Beautiful Bill. The grant, I'm told, has been written. The governor is reviewing it. We're supposed to see a copy of it today or Monday. The kicker is that it's due Monday. So while we may be able to read it, we're not going to have an opportunity to edit it. But this has the potential to bring over $500 million to the state of Wyoming over 5 years. So we're anxious to see how we here in Pinedale will be able to access some of that money. And then I talked a little bit about how we're wanting to prepare our clinics for this increased volume, the increased number of physicians that I referred to earlier. Over time, we have converted a number of exam rooms into offices as we had need for office space. So I suggested to the board, and they agreed with the idea that now that we have a lot of vacant space down at the Sublette Center, we should take advantage of that, convert some of our clinical space back into exam room or physician office space. So over the next couple of weeks, we're going to be moving, and including administration. So I'll be moving out of the new hospital building and moving down to the Sublette Center so that we can better take advantage of the space to provide patient care, which after all is our priority here. The board had a relatively brief executive session talking about legally protected matters, including physician contracts, employment issues. And the last thing I should mention is that the board approved a new health insurance plan, medical insurance plan for our employees. The plan largely maintains the benefit structure that we've had in the past. It does it in a little bit different way, but not a huge negative impact to the employees, and it's a significant savings for the organization. We're estimating about $380,000 savings from what we've been paying this year. So at a time when cash is tight, that savings is very makes us very happy. Hope you found this update useful. As always, give me a call if I can answer any questions for you. Thank you.